My name is Karen Tamulonis. I am an RN BSN since 1991, and I've worked exclusively in pediatrics at Rush University Medical Center in Chicago. My very first patient was an oncology patient, a young teen with osteosarcoma, and I happened to be precepted by somebody who was absolutely passionate about oncology care. And that was it. That was it for me. I worked inpatient for 16 years on a pediatric med surg floor, which had a lot of oncology patients, but I fought for those patients. That was probably I was most passionate about that population. Anywhere from, young toddlers to we took, 20, 21-year olds. And in the meantime, I had four kids. I had a daughter and then triplets. I had two boys and a girl. And once they got old enough, I was very interested in working in the clinic situation. So I went over to the Peds Hemonc Infusion Center, and I've been there now for another 15, 16 years, which has been probably my most favorite because I get to be so much more involved with my families. I really get to help with the other nurses that I work with. Um, Help these families navigate this absolutely traumatic experience of having a child with cancer and becoming part of their team. We're a small program sandwiched between two big programs in the city, and we get to really be a significant part of their team. The patients see the same nurses every time, and we become very close with them and help them through that year to 3 years of treatment, and then we follow our kids for another, 5 years um, in follow up. So it's just an incredibly rewarding experience, and um, I had on an aside, I had an experience of my mother was diagnosed with triple negative breast cancer when she was 72 years old. And even though I know squat about adult cancers, I was able to help her through that process, and happy to say she's a 12-year survivor now. But um, just knowing everything I know about cancer and how to navigate all the highs and lows of that, I was able to help her through that, I'm so grateful I was able to do that for her. My youngest daughter, my triplet daughter, she's baby C. She always wanted to follow my footsteps and become a nurse, and she was able to help a bit with my mom too. And now she's a breast cancer infusion nurse at the same institution, and before that was a stem cell nurse. So she's also become very passionate about cancer, and that just makes me so proud. I'm close to the end of my career. I only have a couple of years left. I'm 62 years old. Um, I I've not been honored before, so this is very meaningful, and especially since I believe it was my daughter that nominated me and wrote about me, which just I'm not sure what the process was, but I believe it was her. I It just means so much that um she has great respect for what I do and decided to follow in my footsteps. And I know she herself is well regarded in breast cancer care. And that just means everything. That just means everything as I near the end of my career in the next couple of years, to receive this nomination and to be acknowledged for what I've done for these past 34 years. I've always felt I don't need rewards. I know how much the care I give for my families matters. And I say families because it's not just the child with cancer, it's the parents, the siblings, whoever needs it, whoever that caregiver is. And we get oodles back from them. We know what we mean to them. And but this is just the icing on the cake. This feels great.